Hello everybody, this is Dr. Jess Delhite. By way of introduction, I'm a partner in Southwest Medical Imaging here in Midland, and I'm the current director of the Breast Center. I went to medical school at Southwestern in Dallas and did my residency at Parkland. Today I want to talk to you a little bit about a subject that a lot of people find confusing and difficult to understand, and I want to shed some light on this, the topic of dense breasts, what you need to know. Maybe you've heard people that say they've got dense breasts and kind of wondered what that exactly is. Well, that's what this little talk is about. So let's get started. What is breast density anyway? Well, in order to understand breast density, you have to understand what the breast is composed of. And it's really composed of three things. Fatty tissue, glandular tissue, including the ducts that conduct the glands that produce the milk to the nipple, and the kind of fibrous tissue that is a support system for the glands and the breast in general. On a mammogram, the fatty part of the breast is dark, and the other parts of the breast, the fibroglandular tissue is what we call it, is white. So the more fibroglandular tissue you have, the whiter the breast is, and the whiter the breast is, the more dense it is. So density is equal to the whiteness of the breast, and it's equal to the proportion of fibroglandular tissue to fat. Now, as a woman ages, typically the fibroglandular portion of the breast decreases in overall percentage, and the breasts become more and more fatty. It's much easier to see breast cancer in a fatty breast than it is in a fibroglandular or dense breast, because dense breast camouflages cancer. And the reason for this is that the cancer tends to be white and the breast is white, and so it's like trying to find a snowball in a blizzard, basically, as opposed to a snowball on a black background. And that's what makes it easier to see breast cancer in fatty breasts compared with dense breasts. Okay, when we read mammograms, we score or grade the breast on the degree of density. As you can see from this diagram, on the far left is an extremely dense breast. This is a breast that's almost completely fibroglandular tissue and has very little breast tissue. Remember, this tends to occur in younger women and premenopausal women in general, and the breast tends to become more fatty over time as a person ages. And as you work your way to the right, you'll see another category called heterogeneously dense, which is basically just a little less dense than extremely dense. And then you have scattered fibroglandular densities and the fatty breast. Now, about 40% of women have dense breasts, at least at some point in time in their lifetime. And so that presents a dilemma, presents a problem for us, because breast cancer is difficult to see in breast density, and also there's a slight increase in the risk of developing cancer in women who have dense breasts. So what causes dense breasts? Well, there really isn't anything a person does to make density of their breast worse or better. The most dense breast you'll ever see is in a woman that's pregnant, because she's preparing to lactate, and all the glands and ducts are getting ready to do their job, which is to feed the baby. The other thing that causes dense breasts is just genetics. Some women have just a proclivity for dense breasts, and some women are fatty from the very beginning. So if you're a woman that has dense breasts, don't feel as if you've done something wrong. So why does having dense breasts, why does it make any difference? Well, I already mentioned one thing, is that it slightly increases your risk of developing cancer in your lifetime. The most important thing to us is that it makes cancer much more difficult to see on a mammogram. So breast cancer in the dense breast can hide for many years, actually, and become very big before you actually can diagnose it. In fact, a lot of times breast cancer, or the mammogram, will be negative just a month or two before a woman presents with a palpable mass that could be 2 or 3 centimeters. So obviously, if that woman had a fatty breast, you would have been able to see it, but you couldn't see it because of the dense breast. And if you wait until something's palpable in the breast, The problem with that is that there's a much higher likelihood, there's about a 50% chance that cancer has spread to the lymph nodes. And even though if it's spread to the lymph node, it's still treatable and curable, it's going to be much more difficult to treat and cure. And in particular, most women that have nodal disease are going to have chemotherapy. If you don't have nodal disease, you probably don't need chemotherapy. So that's a big watershed. And the other thing to mention is that breast cancer, it tends to take years, if it's a relatively normal breast cancer, from when it forms to when it ends up in the lymph node. So you have several years, most women have several years to catch the breast cancer when it's just in the breast and it's completely curable. How do we solve the dense breast dilemma? Well, this is, I've got about 30 plus years of experience in reading mammography, and I've realized from the very beginning, back in the 1980s, that breast density was a problem. And for a long time, nobody really addressed it. They just said, if you don't see something on the mammogram, then the woman doesn't have breast cancer, and women would be coming back with palpable masses and having lots more difficulty in getting their breast cancers treated and cured in the past. But after the millennium, people started thinking that breast density really is a problem and we really need to address it because it does obscure cancer so much, and we're really fooling ourselves and misrepresenting mammography to women if we tell them that if their mammogram is negative, they don't have breast cancer. Because women in dense breasts, the sensitivity of mammography to detect breast cancer can be as low as 30%. And what that means is if you have extremely dense breast, and you line up 10 women that have breast cancer in a breast like that, the mammogram is only going to find 3. And that's pretty appalling when you think about it. 3 out of 10 is the most we're going to be able to find. And so we started thinking, what are some ways that we can get around that? What are ways that we can solve this problem and do a more thorough job of screening women with dense breasts? And one of the things that kind of propelled this into the limelight and into the media was something in Texas that was called Hinda's Law. Hinda is a woman from Dallas, Texas, that was faithfully getting her mammograms every year, starting at age 40, which is what she was supposed to do. And at about age 44, 45, after she had been to the breast center in Dallas, she noticed that she had a lump in her breast. So she came back for a diagnostic study, and the diagnostic study included ultrasound. And the ultrasound revealed about a 2 to 2.5 centimeter mass that looked like a cancer. She had a biopsy, and lo and behold, it was a cancer, and she got very upset. I would too. Here she was coming every year for her mammogram, and she was being told that the mammogram was normal. She was doing everything she possibly could, and yet the mammogram had been year after year missing this cancer, and she had to go for chemotherapy, and she had a much more difficult time in treating this cancer. Now, she's still alive and she hasn't died from it, but she got very active in the Texas government and got them to pass a law saying that if a woman has dense breasts, then the radiologist that reads that as a dense breast has to notify her that her breasts are density and she may benefit from additional screening of the breast, specifically breast screening ultrasound or breast screening MRI. Now, between ultrasound and MRI is actually the most sensitive and specific imaging modality we have for the detection of breast cancer. But the problem is it's expensive and it requires injection of a heavy metal contrast agent called gadolinium. And if you do that year after year, nobody knows what that could potentially do, because we're finding out that this gadolinium gets trapped in parts of the body and it could potentially cause some health issues down the road. We just don't know. So you step down to the ultrasound, it's not quite as good, but the combination of mammography and ultrasound together, particularly 3D mammograms that we have now, gets a lot closer to the level of cancer detection that MRI enjoys now. So we found that ultrasound is probably the most cost-effective and practical way of adding additional screening for women with dense breasts. Now, you might say, Well, if ultrasound sees the cancer and the mammo doesn't see the cancer, why don't we just eliminate the mammogram and just do the ultrasound? A lot of people thought the same thing, but the problem is that one of the other things we see, or we use the mammogram to detect cancer, is what we call microcalcifications, which are these tiny little grains of salt or grains of sand that show up as white dots on the mammogram. Well, the mammogram is very good at picking these little white dots up, but the ultrasound is very poor. Sometimes you can see them, but almost never. So, and the little white dots signify usually a breast cancer that's very early in stage, called DCIS, and some people even call it precancer. So we really want to still catch the breast cancer if we can at that stage. Now, not all breast cancers calcify from the very beginning, and they'll go on to present as a mass, and we have to find them as a mass with either mammogram or ultrasound, but some present as microcalcifications and DCIS, and those are extremely easy to treat, and the cure rate is extremely high, like 99% along that order. So we do the mammogram in dense breast to look for microcalcifications. We do the ultrasound to look for masses. And the other thing I should mention is that now that we have 3D mammography, which slices through the breast, if the breast is not too dense and it has some fat interspersed with the density of the fibroglandular tissue, 3D mammogram is fairly good at picking out masses in that situation as well. Some people think that 3D mammogram alone is enough for a screen and we don't really need the ultrasound, but in my experience of many cases, that's just not true. That ultrasound sees many more suspicious masses and masses in general than 3D mammography will see. So with annual, so when a woman comes in and is diagnosed with a normal mammogram, but she has a dense breast, what we like to do is to recommend a screening ultrasound at that time, because there's a good chance she's going to have other small masses in her breast. Most of them are going to be benign, but we rarely see all of them in the breast on mammography. So when we do the breast screening ultrasound, we typically see several small cysts, small solid but benign appearing masses. But what we're looking for is something that has kind of a dark, irregular border that stands up tall as opposed to flat, and has shadowing behind it. And those are the ones that's the type of mass that we're looking for, and those are the ones we'll tend to biopsy. If we're not sure, if there's like a solid mass in there that has got some benign characteristics, some malignant, we can do one of two things. We can go on a biopsy right then and there to solve that dilemma, or we can follow it closely with another ultrasound in 6 months, because benign things tend to stay the same size and look the same in 6 months, and breast cancers will change and become bigger. They will grow. Now, one of the criticisms of breast screening ultrasound is that it increases what we call false positive results. What that means is we see things that we don't see on the mammogram that we end up biopsying that turn out to be benign. And that's not good, but I would say that it's a pretty small price to pay to do a few extra biopsies of benign things in order to be able to find breast cancer that it's much smaller and at a much lower stage. So even though there's a little bit of expense involved, and of course the anxiety with thinking that you're going to have something in your breast biopsy, I think it's worth it personally. And the other thing to remember is that when even if you have a breast cancer, if it's found in a very early stage, the cure rate is extremely high. And if you wait until it gets bigger and spreads to the lymph node, the cure rate goes down, and the side effects from the treatment go up, and it's much more of a disturbance of your life, and it's much more life-threatening than if you find it early. Cancer, if it's found early enough, is a curable disease. In my opinion, no woman ever has to die of breast cancer, and yet today there are more women that die of breast cancer than people die from car wrecks in the United States every year. And that number is unacceptable and needs to come down. And the only way we're going to bring it down is effectively screening women on an annual basis with mammography. And number two, breast screening ultrasound for those women that have dense breasts. There is an additional cost, of course, for the ultrasound screen, but it's covered by Medicare and usually by insurance. And the other nice thing about ultrasound and MRI is there's no x-ray used, and therefore it's safe. All right, let me give you a few examples of what I'm talking about here. This is a case where you have a small cancer in the middle, in the sea of fat. The gray is actually the fat, so that when I say dark, I mean gray more than black. And you see a tiny, this is less than a centimeter, this is like a half-inch cancer, and it just stands out like a sore thumb, especially if you have the previous mammogram where it wasn't there. So we're able to do a needle biopsy on this. This woman will go for a lumpectomy. She'll have some radiation to clean up any cells that might be left behind, and it'll be a speed bump in her life. This will not be a major event. Emotionally, it's going to be a major event, but in terms of getting over it and getting cured, she's going to be a cure. Now, take a look at the case on the right. This is a dense breast, and the red circle is circled around a mass, and you can see it because the circle's on there, but you might not be able to see that if you're just reading it as a mammogram. This is more like a 2.5 or 3 centimeter mass, and that means that it's a higher stage and it's possibly spread to the lymph nodes, and this woman will have surgery, will have radiation, and will probably have chemotherapy, and her odds of living 5 years are reduced. It's not super low, it's probably like 70-80%. Still pretty good, but it's not 99% like we find or like what happens when we find it at a very early stage. So the key to getting a handle on breast cancer and taking care of yourself and not dying or not having to suffer from this disease is to detect it early. That is the key. Any breast cancer at some point in time is curable if it's found early enough. Okay, now here's an example of a dense breast mammogram that, we would call normal. We would say it's dense breast, and we have a little disclaimer that we say dense breast can obscure a cancer, and therefore there's about a 10% chance that you could have a cancer in there that we don't see. Well, here's an example. This is a woman that would have gone on for maybe a year or two before this was discovered as a palpable mass. And now we've done the ultrasound, which is on the right, and you see that little dark, irregular, slightly shadowing mass that's there that's probably on the order of 7 or 8 millimeters, or about a half of an inch. And that's a small invasive breast cancer, and it gets taken out and she gets cured. Okay, so who should get breast screening ultrasound? There's a little bit of a controversy, and let me run through it with you. Basically, there's one camp that says only high-risk women should get breast screening ultrasound if they have dense breasts. And there's another camp, which I belong in, that says that I believe everybody who has dense breasts should get a breast screening ultrasound. And I'll walk through my rationale on that. Now let's talk about average versus high-risk breast cancer. The average person will have, if you just sampled them or surveyed them, they would have about a 12% or 1 in 8 chance of developing breast cancer over their lifetime. It's not like every year you have a 12% chance of developing breast cancer. And breast cancer tends to be it's a disease of older women. It peaks at about age 65, 70. It's a lot less frequent in a patient that's 40 or under, but it does occur, but it slowly ramps up over time. Biggest risk factor for developing breast cancer in any woman is age, not family history. That's a misnomer. Okay, so women that are in high risk are usually women that have a family history. Now you can have a family history and then you can have a family history, all right? Meaning that you can have a great aunt that had breast cancer, and that's not nearly as high a category as if your mother and your sister had breast cancer. So there's something called a Gale score that we do on every person that comes to the breast center that gives us a percentage of lifetime risk. And if you fall in the category of 13 to 20%, which is about 1 in 7 to 1 in 5, something like that, you're in a kind of intermediate or moderate risk category. Now, anybody who has a risk of greater than 20% is considered to be very high risk. Those people have a strong family history. First-degree relatives, such as mothers, sisters, tend to have breast cancer. And they have breast cancer at a younger age, premenopausal breast cancer, which is kind of a sign of family history. because most breast cancer occurs postmenopausal. And the people that have really problems are the ones that have a particular genetic mutation called BRCA, or BRCA1 and 2. And those women have developed cancers at a much younger age and a much higher rate than the average people, as much as 60%. And they have very aggressive tumors that are very difficult to treat. So those are the super deadly cancers. So if you have a BRCA gene mutation, a lot of women are opting for mastectomy. But if you have that high of a risk, we're going to go right to MRI. We're not going to mess around with just the mammogram and the ultrasound. We're going to go to our biggest gun, and you're going to get a screening breast MRI every year, starting probably at the age of 25 or 30, whenever you discover you have the BRCA gene. And then, of course, famously, Angelina Jolie has done double mastectomies to eliminate all breast tissue, so that she has virtually no chance of developing breast cancer. Pretty much everybody agrees that if you have intermediate risk or high risk and you have dense breast, you're going to do some other form of screening. You're either going to do at least ultrasound for the women between 13 and 20% lifetime risk, and you're going to do MRI for the ones after 20%. But how about the average women? Okay, well, this is where there's a lot of controversy. The yield of finding breast cancer on average risk patients is lower, obviously, because they don't have as much of a risk, and the rate of biopsying things that are benign that we wouldn't have seen otherwise on a mammogram, in other words, the false positives, are higher, and so it ends up costing a lot of money, and some people say it's just not worth it. The thing is that only 25% of women that develop breast cancer have a family history. A very small percentage of women have the BRCA gene, fortunately. But that means that 75% of women that develop breast cancer in their life have no family history. So the misnomer is that, oh, well, breast cancer doesn't run in my family, so I don't need to get screened because I'm not likely to get it. That's wrong. The reality is that everybody has a chance of getting it, either average, intermediate, or high risk of getting it. But a full 75% of women that develop breast cancer in their lifetime have no family history. So that's some of the rationale of why I like to recommend breast screening ultrasound for all women with that dense breast, because otherwise you're kind of rolling the dice. So with annual screening 3D mammogram, which I'll talk to you about in another session, and breast screening ultrasound, we got you covered. There's almost no place for breast cancer to hide when we do that type of screening. So I would strongly encourage you, if you get a dense breast reading on your mammogram today or from before, that you make sure that you get breast screening ultrasound. It could literally save your life. Thank you.